Nutrition. So nutrition, we know that we need to have a balanced nutrition for our bodies. Our bodies needs the balanced nutrition. And choosemyplate.gov is a great resource we can give our clients to understand about portion control and how much should be on their plate. Now in the United States, we are known to be the worst, the absolute worst in nutrition. There's more grains, dairy, more carbs on the plate rather than fruits, vegetables, protein, grains, dairy in a proportion. So nutrition is the study of food. It's how it affects the body and influences our health, especially with diabetics, people who have chronic diseases, such as cardiovascular diseases, liver problems. So adequate nutrition is essential to our wellness. So there's three major nutrients. There's carbs, carbohydrates, proteins, and lipids. Lipids are fats. So they're the building blocks for our cells and our tissues. They help supply that energy. Those kilocalories, those are macro. Those macros are essential. We need that for that energy. Then we have micros. So that helps manufacture, maintain, and repair our cells. It's found in our foods. It can change and be used in the body through our metabolism. So carbohydrates, primary energy source. We have sugars. They're easily digested in protein and lipids. So remember, those carbs have turned into sugars. So it all depends on simple carbs or complex carbs. So they provide nearly all the energy for our brain. So the glucose in our liver, skeletal muscle tissue called glycogen, okay? So it's converted back into the glucose to meet our energy needs, the glycogenesis. So if no carbs are available, protein and fats can be used for energy, such as like the keto diet. They have a high fat content, so their body is starting to think, okay, there's no available carbs right now, so I'm going to use the fats and the protein for my energy. So there's spare proteins, especially for malnourished patients. This can be seen. So this is where glycogen stores are very low. Physical activity can cause a breakdown of the body. Stores of proteins and lipids for their energy. Again, when those proteins are used for energy, they're not available for their primary function, which is tissue growth, maintenance, repair. That fat are converted directly into an alternative fuel called ketones. So ketones raise the acidity in the blood and can cause like that acid-base imbalance. So fats are used for fuel in people who have diabetes, so whose cells cannot use glucose for energy. We have, so again, when protein is used for energy, they cannot do their function fully. The tissue growth, maintenance, repair. Ketones, so that fat converts directly into an alternative fuel. Let's see. Insulin. So insulin is a pancreatic hormone. It promotes glucose movement into the cells. Okay, proteins. So proteins, again, it's useful for that tissue building. So the protein, except for water, actually makes up the biggest part of our body. It's essential for growth, maintenance, and repair of the body cells and tissue. Then there's a nitrogen balance. The nitrogen balance occurs when the intake and output of nitrogen are equal. There should be this nice equal balance between that, the positive, okay? So the intake and the output. So a positive nitrogen balance exists when the nitrogen intake exceeds output, making a pool of amino acids available for growth, pregnancy, tissue maintenance, and repair. The negative nitrogen, okay, it exists when the intake is lower than the actual loss. So this can occur with an illness, injury, or malnutrition. Amino acids. So we need amino acids, okay, and it's in our protein. So usually we have complete protein. So it contains all the essential amino acids necessary for the protein synthesis. So that is involved from our animal sources. Now then there's incomplete. So incomplete proteins is going to not provide all of the essential amino acids, but so these are coming from like nuts, grains, but keep in mind, so such as for like a vegetarian, they don't eat meat. But if they took 2 incomplete proteins, 1 complete protein will be made. So such as if they took lentils and rice with yellow peppers, makes a pretty healthy meal. And that's going to make 1 whole complete protein. Okay. Lipids, so are fats. So it's a key component of the lipoproteins, soluble in water. So liquids that are solid at a room temperature are called fats, whereas the liquid at room temperature, okay, or liquid at a room temp are called oils. So lipids that are solid at a room temp is called fats, whereas lipids that are liquid at a room temp are called oil. So it's essential for backup energy. Strenuous physical activity will burn fat for energy. Burns fat for energy when glycogen stores are low. It's important for our organ installation and protection. So installation protects our vital organs, thermal regulations, accurate nerve impulse transmissions, cell metabolism. Now to go back at the backup energy source, we know that carbohydrates is our primary energy source, right? But our body will burn fat for energy, especially during those strenuous exercises. Lipids are a very important component of every cell membrane, and it is very, very important to cell metabolism. So micronutrients. So we only need these in small amounts. They help regulate our body functions. So then there's vitamins. So they help with metabolism or preventing a particular deficiency disease, such as folic acid. So women who, let's say, I'll actually give you a perfect example. So if I get pregnant, or when I was pregnant with my son, I actually took a high dose of folic acid because my husband had a neuro defect called spina bifida occulta, which is the very minor, didn't even know he had it until we did an MRI one day. They're like, did you know you had this? And he's like, no. We're like, well, I don't know what that is. So, but in pregnancy, they want the mother to have a high intake of folic acid because that's going to help decrease that risk. Then there's minerals. So a calcium deficiency is most common mineral deficiency in the United States. So when the calcium is low, most likely their vitamin D is going to be low as well. So vitamins. Let's talk about vitamins. Fat soluble. So we have A, D, E, K. The body can store those, and we don't need to consume them daily. We get them from our diet. Water-soluble vitamins, C, and all the B complex vitamins. So excess amount of these is going to be excreted by the kidneys through our urine. The body does not store these, and it needs to be consumed every day, and we get this a lot from our food as well. So vitamin A, what does it do? So vitamin A is essential for our vision health. Vitamin D fortifies our bones. Okay, it's essential for our bones. Vitamin E, our heart health, cholesterol. Vitamin K, okay, the coagulation, problems with their circulation, and we're going to break these down just a little bit more. Okay, so water-soluble vitamins. So these are just some examples of food where you can get these vitamins. Now, these aren't the only foods that you can get these vitamins in. These are just simple examples. So thiamine, looks like there's peas, riboflavin, it looks like wheat, niacin, nuts, biotin is eggs, B6, hummus, okay, B5 looks like chicken, vitamin C are fruits, vitamin B12 definitely are meats, and folate are grains. So water. So it makes up large percentage of our body weight, 55 to 65% for men, 50 to 55% for women. It's a basic solvent for our chemical process. It helps transport substances. It's very important that we have this, especially it helps circulate as a component of blood. It's like a help transport oxygen, nutrients, and metabolic waste. The body structure and form, so water fills in the space in the body tissues, so such as the muscles. Helps maintain body temperature. So as our temperature will start to rise, we're going to start having that evaporation of sweat because then it helps cool our body. So energy balance concepts. So energy and nutrients measures in calories. We know this. So the calories in must equal the calories burned. So if there's too little of calories or nutrients, this patient most likely is going to be undernourished. If there's too many calories and not enough burned, that could be leading to obesity. Now, we talked about in class how an obese client can be malnourished because then they're not getting enough to maintain what they need. So BMR, we use the BMR, it's called the basal metabolic rate. So it's the amount of energy required at rest. Then there's the total energy needs. So replacing calories used for the BMR and physical activity. So what does this all mean? So the BMR, it's a measurement of the energy used while at rest in a neutral temperature environment. So it's understanding the energy required for those vital organs we have, such as our heart, liver, and brain to function. So factors that can affect our nutrition. It could be developmental. So at specific developmental stages, nutritional needs and eating patterns will vary depending on their psychological growth, activity level, disease prevention. So an infant to an elderly, they may need and they will need totally different nutrients. Same thing with a woman who's lactating or someone who's pregnant. Now, lactating women, they may need some different type of nutrients for their child. So again, folic acid intake is very crucial to prevent any neural tube defects. Typically, it's going to be 800 micrograms. So I gave you the example of me. I actually take 4 milligrams. So that's 4,000 micrograms to ensure my child does not get a neural tube defect. Educational level. So this could mean that they just don't understand. And also it could mean that maybe they don't have the means to get good nutritional food. Knowledge of nutrition, it includes the concepts of access. So just like we were talking about, educational and knowledge of nutrition, they go hand in hand. Your client may be on a very fixed income and they can only afford canned foods, or they can only afford the most simplest foods that are cheap and high in calories, high in carbs, not the healthiest, which is going to lead to problems down the road. So more factors that affect their nutrition. So we have lifestyles, so dietary patterns, if they're vegetarianism, if they're dieting, that can affect their nutrition. ethnicity and culture. Okay, there's different ethnicities that do something completely different than what I might do, and that could be a factor on their nutrition. Religious practices, disease processes, functional limitations. So to go back to the vegetarianism, so some vegetarians will allow eating fish, eggs, dairy products, as well as plant-based foods. So those are semi-vegetarians. Then there's the ovo-lacto vegetarians that are a little bit more strict. They eat eggs and dairy products, but they don't eat fish at all. Lacto-vegetarians, they only consume plant-based foods and dairy. Then we have vegans. So vegans are going to only eat foods of a plant origin or a fruitation diet, such as fruit, nuts, honey, vegetable oils, soybeans, soy milk, tofu, processed protein products that can be used by all. But really they are very strict on their diet. So with the ethnicity and culture, some food choices, okay, there may be higher in one type of food than another. So let's talk about like rice in warm wetlands and then potatoes in colder climates. So it also takes an effect of, okay, how readily available are these foods, especially in the regions that they live. Now, some religions, they require people to fast or abstaining from certain foods. So, for an example, Roman Catholics fast on Ash Wednesday and Good Friday. Kosher diet law prohibits eating pork and shellfish. The disease processes. So, diabetes and like a GI disorder can definitely alter those nutrient intake, digestion, absorption, how it's used, any excretion. It all takes effect of that as well. And then functional limitations is, can the person help themselves and help, like, do they know whether or not that they have eaten? Do they remember that they ate, and is that going to cause them to overeat over time? Especially if they have a severe mental illness, confusion, any developmental delay. This can all be a factor for any functional limitations. So here's a question. Identify the client with the greatest risk for developing protein-calorie malnutrition. Do you think it is a client who has multiple sclerosis and is in a wheelchair? A client weighing 300 pounds who has entered the hospital for cardiac bypass surgery. A client with a broken arm and femur from trauma who is running a fever of 101.5. Or a client who is of a Native American heritage. Who do you think is at the greatest risk for developing protein-calorie malnutrition? It's C. So this client has the greatest risk because of that metabolic demand for energy. And it's running the greatest risk of not having those energy demands met. So alterations in nutrition. So overweight and obesity. 2/3 of our adult population has a chronic disease, such as diabetes, hypertension, CAD, they've had a stroke, gallbladder disease, gout, obstructive sleep apnea. So if a person is 40% overweight, is most likely to die prematurely than a normal weight person. They're consuming the nutrients. So in an excess of metabolic demands, more than needed for their activity, gender, height, and weight. So overweight, their BMI is going to be 25 to 29.9. Obesity, their BMI will be greater than 30. Alterations in nutrition continue. So underweight, under nutrition, insufficient intake of protein, fat, vitamins, and minerals. So the causes of being underweight could be from multiple factors. Could be psychological, social, economical, physiological, such as any illness or eating disorder. So a person can be malnourished with regard to specific nutrients without being underweight. So keep that in mind. They don't have to be skinny, just like this picture. They can be an overweight patient and be undernutritioned. Okay, so they're consuming less calories than needed according to their activity, gender, height, and weight. So we're going to screen for nutritional problems. So we got to ask their diet history. In the last 24 hours, what can they recall and what did they eat? Food frequency questionnaire. Maybe ask them if they do record their food, see what they recorded. Subjective global assessment. So this means look at the area that they live in. How is the area they live in? So if you're comparing from the United States to Nigeria, or United States to Ireland, United States to Mexico, like in the farmlands, it's going to be different. It is going to be different. We did this in lab, so we're going to do a mini nutritional assessment. We're going to ask them some questions and then determine, are they underweight, malnourished, undernourished, overnourished, etc. So identifying those nutritional imbalances. We're going to complete that physical exam. We're going to do that general survey. Just by looking at them, we're going to get so much information. And then we're going to look at their vital signs. How is their vital signs? Are they tachy? Are they Brady? Are they hypertensive, hypotensive? Look at their poor skin turgor. Okay. Wound healing. Do they have a concave abdomen or do they have ascites, so that distended abdomen? Change in muscle mass. Do they have atrophy? Laboratory results. We're going to look at their labs. Changes in blood glucose. The glucose indicates the amount of fuel available for their cells. The levels above the normal set point trigger the release of insulin. So it causes the glucose to move into the body cells and be stored in the liver and muscles. A level below normal, okay, triggers the release of glucagon, leading the release of glucose from storage. So remember, we have glucose in storage, so when our levels get low, so we don't completely crash, it releases glucagon into our bloodstream, so then we have it into our body, so then we have that glucose to help rise it. Serum albumin. So albumin, it's synthesized in the liver. So low levels of albumin are associated with malnutrition, malabsorption, acute chronic liver disease, repeated loss of protein through burns, wounds. But the best way to get this is actually going to be from pre-albumin. Creatine. Creatine is going to be excreted through the kidneys. It's an excellent indicator for renal function. So increased level may indicate there's an impaired kidney function or any loss of muscle mass. Then we want to look at their hemoglobin. So our hemoglobin, it's going to detect if we have an adequate iron intake. Okay, do we have enough blood? Then we're looking more at blood glucose. So like we talked about, it indicates amount of fuel ready available for the cellular energy. So it should be, their blood level should be 70 to 100 milligrams per deciliter. Hypoglycemia, okay, they have symptoms such as weakness to a coma. They can go into a coma. Hyperglycemia, so think of the 3 Ps. If you know they have a high sugar level, they most likely are exhibiting these symptoms. Polydyspnea, which is increased thirst, polyphagia, excess hunger, and polyuria, which is increased urination. They will have some vision problems over chronic periods of time. Like if a chronic period of time that they've been hyperglycemic, there's too much sugar in the blood and it's going to start damaging the vessels. So that's when it gets into the vision problems, peripheral neuropathy. Serum albumin. So again, we talked about low albumin levels associated with malnutrition, malabsorption, acute and chronic liver disease. So repeated loss of protein with burns, wounds. But the best indicator is going to be your pre-albumin serum level. So serum, okay, if you don't know this, serum actually means blood. So if I'm getting a serum albumin, that means I'm getting a blood test of albumin. So, but to see if they're malnourished, you're going to do a pre-albumin blood test. This fluctuates daily. It's a better marker of acute change than albumin, because albumin has a half-life of, I believe it's about like 18 to 21 days, which there's such a huge lag on detecting if there's nutritional problems, where this fluctuates every day. So another thing is if a patient is fluid overloaded, they will actually have a false low albumin level. So creatinine, again, is excreted through the kidneys. It's an indicator of renal function. Increased level, okay, it could mean that there's an impaired kidney function or a loss of muscle mass. Hemoglobin, okay, so it's an iron-rich compound, and it's a serum protein. Low could indicate inadequate iron intake, chronic blood loss. So question, the nurse knows the lab result that is the best indicator of a client's nutritional status is the serum albumin. You all should know this is false. Pre-albumin has a shorter half-life than albumin, and it is the best indicator because it fluctuates every day. So some nursing diagnosis examples for malnourishment or overnourishment is, for malnourishment, adult failure to thrive. Impaired nutrition, so less than the body requirements. Impaired nutrition, more than the body requirements. Risk for imbalanced nutrition, more than the body requirements. Self-care deficient, so such as feeding. Related to chewing and impaired swallowing. So keep in mind, you always have to give that nursing diagnosis, and then what is it related to, or what's your evidence that shows that? So managing these imbalances. So let's plan them. So we got to identify the reason. What's the etiology of that imbalance? So examples of undernutrition could mean they have difficulty chewing, swallowing, alcoholism. It could be a metabolic disorder, such as diabetes, any GI disorders, fevers, the dentures not fitting correctly, especially if they've lost weight. They're going to have more of a sunken face, and those dentures are not going to fit. If they've just been eating soft foods, okay, there's a lack of fiber. Examples of the etiology for overnutrition. So overeating, lack of exercise, there could be an endocrine issue. So thyroid issues is a big deal for overnutrition. So Healthy People 2020, I know it is 2020, so they'll be changing it soon. They'll be changing it by 21. But they have an outcome. So one of the goals is to help promote health and reduction of chronic disease associated with diet and weight. And this has been a goal for the last 10 years. Now, I'm assuming, and my bet is this goal will remain, but they're going to be more specific. Now, there's been a lot of plans out there that have helped people to help them reduce their chronic disease and increase their health just by doing diet plans, activities, especially children. So nowadays there's so much media, so much electronics that now children are just sitting, right? We're not up going out and like getting active. So I can see how they may change the goals and be very specific in the next few years. So think about that and how you can promote health and reduction of chronic disease associated with diet and weight. So interventions. let's talk about them. We have Meals on Wheels here. So we could do client and family teaching related to any vitamins or mineral supplements, obtaining nutritious foods on a limited budget. So what you could do is literally know their budget. You could do this. This is a job people do, is they ask the family, what's your budget? And then you and that head of the household, you guys go through the flyer for Safeway or something, and you literally pick out foods that they like, but within that budget. And it has to be realistic. It has to be a realistic budget. So if there's a limited budget, okay, especially for our elderly, there's Meals on Wheels. So everyone older than the age of 60, regardless of their income, can get a hot meal, okay, at noon at a lot of community centers. So anyone who is ill or disabled can receive meals at home. So that's the Meals on Wheels. So these programs are funded by public and private partnerships. So the homeless is a perfect example. They can go to the community center and get a free meal. There's home delivered meal programs, the congregate meal programs. So supporting the special client's nutritional needs. So if a patient's NPO, it's ideally to keep them NPO in the morning. Don't have them NPO all day, especially if there's a test in the afternoon. Ask the doctor, okay, how long do you want them to be NPO? Because your patient's going to get hangry. Let's just be honest. So if they have a test at 6, but then the doctor writes NPO at midnight, like that's just ridiculous. So advocate for your patient. Older adults. So assisting the clients with meals. Inpatient, we can delegate our feedings. Home care, we can refer to an agency for helping obtain food. Some interventions for obesity. So assist with calorie calculations and meal planning. Encourage exercise and lifestyle changes. So 15 to 20 minutes a day, max of 30. Weigh weekly and suggest a food diary. Interventions for other nutritional imbalances. So some interventions for undernutrition. Encourage the client to seek counseling for their eating disorder management if that is the problem. Devise strategies to improve the client's appetite. So figure out what they like to eat. Okay, that's a big thing. They may need internal feedings. Okay, they may. And then you're going to have to deal with that psychosocial. You're going to have to, or the physiological or psychological, that psychological process. Because if it was this young woman here and she's getting a feeding tube, that's a lot to take on. That's a lot to take on. And maybe it's because of her eating disorder and now she has to have this. Because another thing is you want to be very strategic when you have a patient who's undernutritioned, or especially if they have an eating disorder, if they are in a area where there's highs in poverty. You don't want to just shove down a big old Big Mac on them, right? Okay, you can't. Their body, they're going to get sick. They're going to absolutely get sick. You have to take it step by step by step to make sure you are not creating any complications for them. They may need parental nutrition, which is TPN through the IV. And that you'll definitely have to monitor all their lab values, GI status. You have to know how to manage these tubes so that you can detect any complications. So, like we talked about for both nutrition, so monitor the tube placement, lab values, and their skin condition. So modified diets. So we did these in lab, but I'm just going to go over them again. So a regular diet, there's no restrictions. NPO, nothing by mouth. A clear liquid, patients who are just getting out of surgery, a GI disorder, any acute illness. Full liquid, So transition to a soft diet could be acute gastritis. So let's talk about some examples. So let's go back to clear liquid diet. So we know that it's going to be after surgery if they have a GI disorder or acute illness. So these drinks, they have to be at room temperature and no residue. So they could have water, tea, coffee, broth, clear juices, ginger ale, Jello. You really want to be careful with any carbonated drinks that has caffeine because that caffeine is actually going to upset their stomach. Excuse me. A full liquid diet, so that's a transition to soft diet, or if they have acute gastritis. So they can have everything in the clear liquid, but now they can add more. They can have milk, pudding, soups, ice cream, sherbet, fruit juices, vegetable juice like a V8. A high fiber diet. So high fiber is going to be more of those whole grains, raw or dried fruit. You're going to put your patient on a high fiber diet, especially if they're constipated. This is the first thing you want to do is get them up with their fiber because that's going to help with that motility. Blender diets, a liquid diet, which is a puree diet. So these patients just had oral or facial surgery, their jaw was wired, or if they have any chewing difficulties. So it's going to be foods or liquids pureed into a liquid form. So they could still have a steak, vegetables, fruit, scrambled eggs are pureed. Soft or low fiber diet. So that transition from a full liquid to a regular diet. So no raw fruits or veggies, no foods that cause a gas. It has to be easy to digest for a low fiber diet. Mechanical soft, these clients have chewing difficulties. They don't have teeth. Maybe they have a swallowing problem. So it has to deal with minimal chewing. So ground meat, vegetables that are diced, canned fruit, honey is okay, butter, gravy for flavor. Liquid consistencies. So we have thin. Thin is like all of our liquids we drink now. Okay, so we can have the broth, the coffee, ginger ale. Then there's nectar. Nectar is a heavy syrup. Think of it like this type of thickness, you can still drink through a straw, such as like a milkshake. Cream soup. Then there's honey. It gets even thicker. So it's pourable. It's eaten with a spoon. Okay, this type of thickness, you can't sip it through a straw. Okay. Spoon thick, you definitely need to eat it with a spoon, such as like a custard thickness, pudding, or hot cereal. Now, keep in mind that these patients, okay, or I'm sorry, keep in mind, when I say straw, I'm just giving you an example on the thickness. Any patients that's on a thickened liquid or a dysphagia diet or their aspiration risk, you never want to put them on, you never want to give them a straw. It's an aspiration risk. So let's go over your electrolytes. So your sodium, it maintains the fluid volume, our muscle contraction, our nerve impulses. So your levels are 136 to 145 milliequivalents per liter. Potassium is very important, so it's a fluid volume inside our cells, muscle contraction, it deals heavily with our heart. So 3.5 to 5 milliequivalents per liter. Calcium is important. These are all very important. So calcium helps with our bones, teeth formation, our blood pressure, blood clotting, our nerve transmission. And what is my range? Good. 9 to 10.5 milligrams per deciliter. Magnesium. So smooth muscle relaxant. So our skeletal muscles are smooth muscles. So 1.3 to 2.1. So we're not done yet. So instead of just making a whole brand new slide, we're just going to chat. Okay. So let's talk about the different foods. the different foods that you can find with all these different nutrients that we talked about today. So we have fiber. So we talked about how fiber is going to be more those going to be plant foods that are ingestible. Okay, that's dietary fiber. Fiber is a type of carb. Fiber is going to help you bulk up. It's important for our bowel elimination. It bulks up to the feces and stimulates that peristalsis to ease elimination. So that raw, dried fruit, whole grains, is great. Now, how much fiber should we get? So at 25 grams a day for women and 38 for men. So proteins. We talked about proteins. So we talked about how there's complete proteins, incomplete proteins. Two incomplete proteins is going to make one complete protein. Okay. Let's see. Vegans. Vegans are going to lack vitamin B12 because it's not naturally found in our plants. And vegans are plant-based diet only. So our lipids. So we know our lipids are going to come from dark meat, poultry skin, dairy products, added oils, margarine, butter, shortening, oils, lard. People still use lard. But we need to know, about the types of fats. So we have LDL. What does LDL stand for? LDL is low density lipoproteins. So that is bad protein, or not bad protein, sorry, bad fat, bad lipid. Then we have the HDL, which is the high density lipoproteins. That's our good protein. Not good protein. I keep saying protein because there's protein, but good fat. That's our good fat. So our saturated fatty acids, they're going to be at primarily found in our animal sources. Our unsaturated fats, okay, it's going to be a mixture of plant sources. Essential fatty acids, it's broken down fats, okay, it must be supplied by our diet. So how about if they have too much cholesterol, what's going to happen? It's going to cause, there's going to be a buildup in the tissues causing congestion of that cholesterol, and it's going to increase their risk for cardiovascular disease. So how much cholesterol should they have? So it should be limited to 200 to 300 milligrams a day. So if they're on a low cholesterol diet, it's ideal to be less than the 200, okay, or 300, okay, ideally. In this book, it says 200 to 300, so just do 200, okay. Vitamin C. So our vitamin C, it's in our citrus fruits, okay? Those wonderful oranges, lemons, tomatoes, peppers, green leafy vegetables, strawberries. It's essential for our healing, okay? Collagen formation, immune system function. We talked about vitamin A. Vitamin A, our sources are yellow, orange fruits, veggies, fatty fish. So vitamin A is very essential for our vision. Vitamin D can be found in our fish, egg yolks, sunlight, but even in Arizona, the #1 deficiency is vitamin D. So we're going to continue. Vitamin D helps maintain that serum. So helps with the calcium and phosphorus to aid in that bone development. Vitamin E can be found in our veggie oils, grains, nuts, helps with protecting vitamin A. Vitamin K. So vitamin K is a very important one. So it's from green leafy vegetables, eggs. It's essential for prothrombin synthesis and aids in bone metabolism. So it helps with our blood clotting. A deficiency could result in increased bleeding time. It's actually used as an antidote for excess anticoagulants. So if they're taking warfarin, they'll be asked, if their blood is too thin, their doctor may actually tell them, okay, why don't you eat some more green leafy vegetables? But ideally, they'll probably just lessen their dose. But if they don't want their blood to start clotting, then they're going to tell them to stay away from those types of foods. So vitamin K, again, can be found in dark green vegetables, spinach, broccoli, eggs, carrots. So make sure you guys are looking at your electrolytes and what type of food you can find your electrolytes in. And that's pretty much all I wanted to cover for this lecture because we did a lot in class. So if you have any questions, let me know and I'll be happy to help.